is Dr. Shen, and I'm a pathologist. Today I'm going to continue my new series, Microscopic Correlation with Common Diseases, episode number 3, Lung Cancer Screening. So there is a guidelines about who should get lung cancer screening. So the guideline right now is if you are current or former smokers, and you are between 50 to 77 years old, and if you have a 20 pack year smoking history. And usually they start with the x-ray for the beginning of the lung cancer screening. So this is a real x-ray picture, and it shows you have a bronchus and you have bilateral lungs. Depending on the location, we have some lesion in the central, means it's like close to the middle of your body, midline of your body, and also there are peripheral locations, which referred as peripheral, like this part. And if they find something abnormal on X-ray, they are going to do further screening, like CT. So there is a big mass in the central location, which means close to the bronchus. And there is a lesion at the peripheral location, looks like this tumor. And also there is a tumor abutting the pleural location. So depending on the location, clinicians, they can have different ways to biopsy these different tumors. Like if the lesion is in the middle, close to the bronchus, they can do a EBUS. So a EBUS means you put endobronchial ultrasound guided tube. It is located to the left and the right bronchus, and they can stick a needle in if they found some abnormal signals, which usually is a hot spot for the tumor. And they can also biopsy the lymph nodes to stage the cancer. But if the cancer or the tumor is at the peripheral location, like this one, they can do a CT-guided needle biopsy. So they can put a needle from outside of the body and then put a big needle to get some specimen. Same thing for the pleural location tumor. So EBUS is like a minimally invasive procedure. Usually a pulmonologist will do this procedure. And for the CT guided needle biopsy, usually the interventional radiologist will do. So there are a lot of different types of lung cancer, and I'm just showing you a couple most common one. So the first one is called squamous cell carcinoma. What you can see is this is a squamous differentiation with pink cytoplasm, which has a thick keratin. And also there is a bridging between the cells, which is also typical for squamous cell carcinoma. And usually squamous cell carcinoma is located in the central, which means, surrounding the bronchus. And this is not the common type of lung cancer, adenocarcinoma. So they are making tubules, and there is mucin. There's also different kinds of adenocarcinoma, and the different genetic mutations are related, and they have different target therapy. And another aggressive lung cancer is called small cell carcinoma. So from low power, it looks very blue because there is no cytoplasm. It's a lot of nuclear molding, margination, and it has characteristic nuclear features like salt, pepper, chromatin. And usually they will do a test for the PD-L1 to see if certain drugs can do a better chemotherapy. And again, for the right now, the modern oncology, we always do genetic tests and the PD-L1 test on the lung cancer. And depending on the tumor location and the classification of the tumor and the staging of the tumor, clinician can do surgery, radiation, or chemotherapy. Okay, that's the end of my episode of lung cancer screening. I hope this is beneficial. Thank you. I will see you next time.